So again, good morning, everyone. Thank you for joining us. Today, we are going to start off with a presentation by Dr. Ann Rogers, the presentation titled A Good Night's Sleep. A little bit about Dr. Rogers before we get started is she is a tenured professor and nationally renowned sleep expert who joined the Nell Hodgins Woodruff School of Nursing in 2010. Her distinguished research career spans 3 decades and has focused on patients with narcolepsy and adults with insufficient sleep. She earned a doctorate from Northwestern University, a master's degree in nursing from University of Missouri-Columbia, and a bachelor's degree of nursing from University of Iowa. And in 2021, she was appointed as director of Emory University Emeritus College. So thank you, Dr. Rogers, for joining us today, and I'll let you get started with the presentation.
Thank you very much. I'll share my slides and get started. Okay. You should be able, let's see, and then I have to go to slideshow. I tend to use something other than PowerPoint. There. Okay. Just the title. We'll focus on healthy sleep. I'm going to give you some basic information about sleep, talk about how it changes across the lifespan, and symptoms that require assessment and treatment by a sleep specialist, and finally conclude with some questions and hopefully some answers. So I often ask students how much sleep did they get last night? And I'll get anywhere from 4 to 6 to maybe 8 hours. And then I ask them how much they need. And usually the answer is close to 7 or 8, which is really what all adults need. People think they can get by on less, but they really can't. So here's some basic information about sleep. We really don't know the exact amount we need for good sleep, and it does vary. But we know if you get more than 9 hours of sleep, people are more likely to be ill or die. If you get a little amount of sleep, again, there's an increased risk of morbidity and mortality. And we don't know if people are staying awake more during the day or at night because they're ill, they're in pain, they can't get to sleep. Likewise, maybe they're sleeping so much because they're ill. These are large surveys, so we don't know what's causing people to sleep a lot. We do know that insufficient sleep is common among all age groups, and this can be little toddlers to older adults. It's a pervasive problem. I'm sorry about the way the highlighting came out on this. We know that if you don't get enough sleep, particularly in women, because the study happened to be of nurses that they followed since the 1980s, those that didn't get enough sleep had increased risk of diabetes. They had an increased insulin resistance, which precedes diabetes, and increased risk of heart disease. And there were numerous studies, some where they studied a bunch of people at different ages at one time, or others that, like the Nurses' Health Study, where they followed nurses for decades. Both of these studies showed a dose-dependent relationship between sleep duration and obesity, meaning if you got 8 hours of sleep, your risk of developing obesity was a certain amount. If you got 7 hours sleep, your risk of developing obesity might have gone up 10%, 6 hours, 20%. So the more severe sleep deprivation that you experienced over a long period, the greater your risk of becoming obese. We also know it's an independent risk factor for high blood pressure. And that means statistically they sorted it out. And smoking does affect blood pressure, but when they controlled for it, it was sleep. Family history does affect blood pressure, but there's also insufficient sleep heart disease, and all of these things that can affect blood pressure were controlled for, and it still showed that insufficient sleep raised your blood pressure. Maybe only a few millimeters, but it was enough for some people to have high blood pressure. Things that affect sleep. I used to have a TV, now I use a phone. The blue light from the phone stimulates wakefulness. And if you're having trouble sleeping, you really should put the phone down, the iPad, the computer, the TV screen 1 to 2 hours before sleep. If you use your phone as an alarm, turn it face down so you don't see the light at night. Don't pick it up for random texts. This tends to be a problem, particularly with the younger teens and college students. Caffeine is well known, but caffeine hides not only in coffee or tea, but some soft um, it's in cold preps. A lot of the cold medications that say non-drowsy have caffeine in them. So again, and it affects all of us. Some people are more sensitive than others. I remember drinking coffee, working evening shift 3 to 11, going to bed and having no trouble falling asleep. But if you'd actually recorded my sleep, it would have been lighter on evenings that I had coffee close to bedtime. I'm not going to discourage exercise. It's good for so many things, including cardiovascular, but you should avoid exercising right before sleep because it's going to keep you awake. The light bulb was up there to remind us that when we were prior to electrification, we tended to go to bed when it got dark, get up when it got light, and get a lot more sleep. And of course, those that work night shifts or stay up late often have insufficient sleep. Alcohol may make you sleepy at first, but it lightens and fragments your sleep. And those that consume too much on a regular basis actually have pretty long-term sleep changes that even when they quit drinking may take several months to dry out, to improve. And cigarette smoking, people don't often think of nicotine as a drug that is arousal producing. What they found when people quit cigarettes, their sleep improved the first night. They may have felt absolutely lousy, but instead of taking an hour to fall asleep, they were taking 30 minutes. And normally in healthy adults, it takes 15 to 20 minutes to fall asleep after you turn off the light. You tell me in clinic that I fall asleep as soon as my head hits the pillow, I'm thinking you didn't get enough sleep or you've got a sleep disorder. It should take a little while for you to fall asleep. And here's an example of the sleep stages. And R stands for REM or dreaming sleep, and those are the black boxes. And you notice they cluster towards morning. We get most of our dream sleep towards morning, which explains why we sometimes remember our dreams because if we wake up. And then you see towards 2100 or 9, that person went to bed around 9:30-ish. You see them dropping into N3, which is deep sleep. So you see most of our deep sleep throughout in the early part of the night. And then there's some brief awakenings as it touches the dotted bar. But people aren't aware of these unless you're awake a minute to a minute and a half. You just wake up, turn over, and don't even remember it. And that's in a healthy young person. We do see less deep sleep and more frequent arousals in an older person. So how does sleep change across the lifespan? The newborn sleeps about 16 to 20 hours, but anybody who's had a newborn in the house knows that they're not all one block. They sleep and wake. They can't maintain sleep. They can't maintain wakefulness. And I mentioned that adults go into non-REM sleep or non-dreaming sleep first, and then have REM sleep occur later in the evening or night. Babies may go into REM sleep first or active sleep, and you'll see their eyes twitch and their mouth move, and then It's a deeper sleep, but their ch sleep changes quickly. About 5 to 6 months, according to researchers, they sleep through the night, but sleeping through the night, according to researchers, is midnight to 5 a.m. But having had a kid, midnight to 5 a.m. felt pretty good compared to every couple hours. Toddlers and preschool uh, children, their sleep is now changed to going into non-REM sleep and then REM sleep. They have all the um, delta and alpha waves and spindles, which are things you see on EEG, that an adult has. They sleep through the night and they usually have a morning and afternoon nap. And by the time they're in preschool, they may have given up the morning nap. And at preschool, they may give up the afternoon nap. And I remember when my daughter did that, I found her falling asleep on the floor in the middle of her toys the first couple of nights that she quit napping in the afternoon, and then she was awake. They usually sleep fine unless they have health problems. They may have a lot of nightmares, though, because especially if they've been watching TV, they can't really tell fantasy from reality, and it may cause them to have nightmares at night. Our school-age children, meaning grade school, fall asleep easily, sleep all night, and they wake up full of energy. Probably the best sleep we'll have, but our sleep changes gradually and we don't notice it. Again, as long as they're healthy and it isn't like asthma's waking them up at night, they're going to fall asleep easily and wake up easily, remain alert all day. Our teenagers, and it's biological. They've tracked the changes as you go through puberty. Your sleep changes. They stay up later, they sleep later. They may have trouble getting up in time for school, especially if you're in a district that has the early start times. Um, this biologically, their body doesn't want to wake up that early. And some states, not Georgia, have made it so that high school students don't start until 8:30. Others will have swim practice at 7:30 in the morning, which is very difficult. Their sleep, they may be developing some sleep problems. You see it, anxiety may crop up, again, having trouble falling asleep. Usually once they fall asleep, they stay asleep. Um, but, but their sleep has changed as a teenager. And usually they sleep pretty well, particularly on vacations. And the question often comes up, do I wake them up on Saturday? Yeah, they need to get up, but they may be compensating, if they go to bed at midnight and have to get up at 6 for school, um, they're going to be sleep deprived. And the states that have moved back the school start times found that students got about 30 minutes more sleep, which was enough to reduce the number of motor vehicle accidents that they had going and coming from school. So what is normal in an adult? As I say, it takes 20 minutes to fall asleep. We sleep approximately 8 hours out of 24. Our sleep is consolidated in one block. We go to bed at night, sleep through the night, and are able to stay awake and alert throughout the day. If somebody is napping, not just because it's Sunday afternoon or Thanksgiving and you've eaten a big dinner and you're lazy, but if they're napping regularly and unable to stay awake, they're either not getting enough sleep or they've developed a sleep disorder. So middle-aged adults, they are able to stay awake and alert all day. Sleep, particularly among women, may be viewed as a disposable commodity. If you want to have time to exercise, they get up early and exercise and cut back on sleep. They've got chores to do, they cut back on sleep. The occurrence of menopause does not necessarily lead to disturbed sleep. Hot flashes themselves don't disturb the sleep. And they've actually done recordings, and women wake up and then they have the hot flash. And they used to put women on hormone replacement therapy just because they had disturbed sleep. And and then they said no to anybody. And now they say, obviously, if you're having hot flashes during the day and you're miserable, hormone replacement therapy is reasonable during the early part of menopause. And if somebody is saying they're having trouble sleeping, who's menopausal or postmenopausal, they're tired all the time, they really need to be seen by a sleep specialist and not just say, change of life, you'll get over it. There are real sleep disorders that affect women and, that occur during menopause. And in both men and women, we begin to see more frequent sleep disorders like sleep apnea and periodic leg movements, which may make people tired. And I'll talk some about that in a few minutes. So what do we see in older adults? Still falling asleep within 20 minutes, still sleeping 8 hours out of 24, particularly in our old. And I'm talking about 75, 80, 85. They may not have all their sleep consolidated in one single period at night. The napping is particularly common, but you may also see napping not just because they're not getting enough sleep at night. It may be cultural, social, people are retired, they can take a nap, or boredom may play a role. Their sleep is lighter and more fragmented. They do wake up more at night. Um, and it's not usually a concern unless they can't get back to sleep. And here's a picture of how sleep changes. Sleep latency is the time it takes to fall asleep. You see that's pretty steady. Wake after sleep onset, WASO. You can see the blue part is getting larger as people move into retirement age. REM sleep is huge. The red during infancy, and it's involved in learning and incorporating things you've learned into long-term memory, but it's pretty stable during adulthood. And again, the green bar for slow wave sleep, which is our deep sleep, decreases, and you see dramatic decreases of this in old age. And people will say their sleep isn't restful. Stage 1 and 2, which is the lightest stages of sleep, this lavender bar, pretty constant throughout life. And you see, people may not even realize they're asleep because you continue to hear things. And if you wake up, and I remember my grandfather saying, "Oh, I was just resting my eyes," and we heard him snoring, but he was in the lightest stages of sleep. And when he woke up, it seemed like he hadn't been asleep. But what you really see in our older adults is the decrease in slow wave sleep and lots more awakening. And this is a graph from the National Sleep Foundation showing the number of hours of sleep. And you see the newborn needs anywhere between 11 to 19 hours. And the infant who's under a year old, a little bit of decrease in the toddler. You see the school age is sleeping anywhere from 7 to 12 hours. The teenager, again, they say 7 to 11 hours. Many of our teenagers are not getting 7 or 8 or 9. And you see the adult anywhere from 6 to 10, although the yellow bars 7 to 9 is ideal. And again, you see the older adult still needing 7 to 8 hours sleep. And many working adults don't get enough sleep because they're busy, but their health is affected. And on the weekend, you'll often see people sleep in later, and that's an indication they're not getting enough sleep. So a couple things requiring attention. There are a lot of sleep disorders. We haven't done the new research, but we knew almost 20 years ago, sleep disorders affected 50 to 70 million Americans, probably more since our population is aged. It cost the nation billions of dollars in medical expenses, lost productivity, and accidents. There are over 80 sleep disorders. Some are insomnia, difficulty staying awake or falling asleep and staying asleep, sleep-related breathing disorders that I'm going to talk about, hypersomnias, which would be the narcolepsy, circadian rhythm disorders. Some people are very naturally what we call larks. They go to bed early, they get up early, or they're owls, they go to bed at 1 or 2 if given a choice. They sleep till 9 or 10. Doesn't work so well with the normal work schedule. Parasomnias would be the sleepwalking, the night terrors. There are sleep-related movement disorders. People regularly kick at night and wake themselves up. There are things called isolated symptoms and normal variants. And this would be like when you fall asleep, you're just falling asleep and all of a sudden your arms jerk. This is a normal muscle discharge. But I'm going to talk about only the most common problems and ones you really should seek attention for. Most patients remain undiagnosed and treated, including 75% of the patients who have obstructive sleep apnea. Unfortunately, that figure hasn't gotten much better in the past almost 20 years. And this is a disorder that can lead to heart attack and stroke unless treated. When to seek attention, if you're normally during sleep, dream sleep, we're paralyzed. Our heart beats, we breathe, but our muscles are paralyzed. We can't move. If I took a reflex hammer and tapped your knee, it wouldn't move. But if your partner is telling you that you're swearing, shouting, you're flailing your arms around, you're making kicking movements in your sleep, even if you're not aware of them, it needs to be paid attention. And these movements can take the form of punching, kicking, leaping or jumping out of bed when dreaming. A lot of our patients will tell us they report dreaming of being attacked and defending themselves, and people have awakened with their spouse's hands around their neck, choking them. And the partner was horrified to find that out when they woke up. If you are injured or they're injured, it's really important. Self-injury occurs in about a third to 3/4 of the patients. They flail their arm and break a lamp. 11% of these injuries require medical attention. 2/3 of the patients' partners report being assaulted or injured. This is a treatable disorder. And it's because the paralysis that occurs during REM sleep is not effective. And I really remember the first time this was discussed in 1985 at the University of Minnesota. Two clinicians were doing an all-night sleep study on a patient for another reason. And the technicians found him crawling around on the floor during the sleep study. And when awakened by the techs, he said he was a tiger stalking something. And seeing the video of it, it really looked like he was stalking something. Who's more likely to have this? Men older than 50 years old. It's often, sometimes an early warning symptom of Parkinson's disease and a few other unusual neuro problems. But it can be associated with alcohol overuse, sedative hypnotics, certain antidepressants like Elavil, or certain SSRIs that have been stopped, and this acting out behavior will occur. So if you're on any of those drugs, be very careful. They usually taper them down rather than stop them quickly. As I said, we do take a health history, a sleep history, exposure to pesticides. We are concerned about alcohol use or smoking. And we do try to get the bed partner to come in because they can tell us from their perspective what's going on. And we will need an overnight study in the lab with video recording. And we'll often see that usually we'll see the muscle tone drop down during REM because we're paralyzed. But in these patients, the muscle tone won't drop down during dreaming. And as I say, we do have treatment. We use certain medications, including melatonin, clonazepam. We are careful about clonazepam. We do encourage safety measures like patting bedside furniture, maybe moving the mattress to the floor, maybe putting pillows between the patient and bed partner. There are firearms in the bedroom. They should be removed or put in a safe. But the drug therapy, including the larger doses of melatonin, can be very effective at stopping the behavior. When to seek attention because you can't fall asleep. All of us are going to have difficulty falling asleep. We have a new job interview. Kids are going away for college. You're going to vacations, sometimes the first night away. But the problems, if they're persisting more than 4 weeks, unfortunately, some of the short-term things like an illness or hospitalization can become chronic problems falling asleep because one of the first things that people do when they can't fall asleep or stay asleep is they stay in bed longer, hoping they'll fall asleep, but then we begin unconsciously associating time in bed with not being able to sleep. We start looking at the clock. Oh my gosh, if I don't fall asleep now, I'm going to be dead at work. You become anxious. And we also get concerned when people have trouble falling asleep, interferes with their daytime activities, their ability to function. And we do have effective treatments that are not always medication. In fact, they're much better than medication. And if you're having trouble falling asleep, you really should stay away from antihistamines like Benadryl, which they often consider safer because you can get it over the counter. But they've shown long-term use of it, unfortunately, even for allergies, can be associated with a greater risk of dementia later on. Risk factors, women more often than men. We see in younger adults more difficulties falling asleep, and our older adults, it's difficulty staying asleep. All kinds of mental health problems, such as depression, anxiety, PTSD, insomnia may be one of the first symptoms of mood changes. Stress, very common. And hopefully nobody's working night shift for public schools, but those that work night shift often have trouble falling asleep and staying asleep because they're asked to sleep during the day, which is going against the light and body clock for sleep. When we see somebody in clinic for sleep, insomnia, we're going to go over their sleep history, their health history. We're going to look at their medications because some medications are associated with difficulties falling asleep. We're also going to ask about their caffeine intake, their alcohol intake, and smoking. We're not going to have them undergo a sleep study unless we suspect some other sleep disorder. All a sleep study would tell us if they have insomnia is they have pretty poor sleep. We don't need to spend money for that. But very often what I see is postmenopausal women coming to clinic telling me they can't stay asleep. And of course, most of our sleeping medications help you fall asleep, not stay asleep. But when I ask them about snoring or daytime sleepiness, what we do the sleep study for is sleep apnea, not insomnia, and we often find it. We rarely use sedatives and hypnotics. There are too many complications with them, particularly when you come off. Stimulus control, again, we often work with psychologists, not because it's a mental health problem, but they're really the best, most effective providers of changing behavior. And that is, don't go to bed until you're sleepy. If you can't fall asleep, get up, do something quiet, non-screen until you fall asleep. You may be up all day first night. Don't sleep during the day and you will be sleepier at night. This is actually more effective than traditional drugs. Of course, it takes a bit of discipline to stay out of bed when you're tired. Cognitive behavioral therapy is available again from psychologists. It's even online, and they've shown the online programs are as effective as working with a therapist. And again, it's changing behaviors around sleep, and this is also more effective than medication. So you might consider these more natural therapies. Snoring should yes, people snore, but there are many conditions when you need to seek treatment for it. Snoring is loud enough to disturb your partner's sleep. If somebody tells you you stop breathing or gasp when you sleep, if you are just excessively sleepy, because a lot of snorers have sleep apnea, waking up to breathe, apnea breathing. So it means not breathing during sleep. If you have high blood pressure, heart disease, stroke, or are getting up to urinate frequently at night, you need to seek evaluation. We know that up to 2/3 of the patients with high blood pressure, particularly if you're on 2 medications or more, you're likely to have sleep-related breathing disorders. People with stroke, and unless you're an older man, 70, 75, or 80, you shouldn't be waking up to urinate at night if you don't have kidney problems. So any of those, and you're snoring, you need to see a sleep specialist. And you can see all kinds of things. People that have congestive heart failure, 3 have sleep-related asthma, breathing disorders. Up to 90% of people after their first stroke have sleep-related breathing disorders. Those that have diabetes, type 2, 2/3 have sleep-related breathing disorders. Those that have morbid obesity, which is usually about a BMI of 40 to 45, between 50 and 90% have sleep-related breathing disorders. And then there are a few other things that if you have these problems, you're at risk for sleep-related breathing disorders. Obstructive sleep apnea is the most common. It affects 4% of men and 2% of women over age 18. That doesn't sound like a lot, but when you think about all the population, United States, only 10% are estimated to be receiving adequate treatment. The majority have not received a diagnosis. A lot of people know their neighbor is on CPAP and they're afraid they're going to get put on this breathing treatment, so they don't go in and get diagnosed. If we're going to have a fewer breathing events, AHI refers to apnea-hypopnea, or decreases in oxygen. If we have as an adult, that's normal. Any kid that has one or more is abnormal. Sometimes we see these breathing events accompanied by oxygen desaturations and arrhythmias, which is irregular heart rhythm. We'll see the heart slow down when the breathing stops and then rapidly increase. I'm not going to play this video, but it was recorded in a sleep lab, and the person literally stopped breathing for 45 seconds, and then there was a huge gasp. If you look at the slides online later, you're welcome to go to that. So how do we treat it? We recommend weight loss if the person is overweight or obese, but this doesn't work in our postmenopausal women who are slender. Prior to menopause, it's associated with weight, both in men and women, and we have about 3 or 4 men diagnosed with sleep apnea to women. After menopause, women are as equally likely to have sleep apnea as men, and it can occur irregardless if you have excess weight or not. Because women, the hormones drop, our airways become more floppy, more likely to collapse. So if there's And only if you're overweight or obese, losing 10% of the weight can make a difference, huge difference. My late partner, who died from other reasons, lost weight to come off his CPAP, which I'll talk about in a minute. Excito SA is a newer device. It stimulates the tongue muscles and strengthens them during wakefulness. And in people with mild apnea, this may be enough to control their breathing at night. Surgery or UPP3 that we used to talk about it, we would carve out all that excess tissue in the back of the airway. The problem is it only worked for 50%, and you couldn't predict who was going to benefit from it. And you're not going to risk surgery with only half benefiting unless somebody's really young and healthy. We have, for somebody whose apnea is mild and only occurs on their back, we might recommend pillows that keep you from turning on your back. They might say put a pocket in your pajama bottoms or tops, and so put a tennis ball in it, but people learn all over. The one on the left, the oral appliance, looks like a mouth guard you might wear for sports, and it pulls the lower jaw forward a few millimeters and opens the airway. Nasal CPAP is a small machine that literally blows air through. The airway opens, the airway prevents it from collapsing, and the person's blood oxygen doesn't drop down. They don't start breathing. This is the one that everybody dreads, but it can make a huge difference. We've had patients say the first night they slept better. The hypoglossal nerve stimulator is the Inspire device that's advertised all over on TV. You won't have to use CPAP, etc. Well, most insurance isn't going to cover it unless you've tried nasal CPAP and it didn't work, which is very few if you tried it every day. Also, most surgeons don't want to take you into surgery unless your BMI is under 35, because if you're heavier, you have a greater risk of surgical complications, and you don't want to do elective surgery in somebody that's high risk. So while we see this advertised a lot on TV, not that many patients are eligible for it. Talk to our patients what it involves, which is an implanted device implanted under the collarbone like a pacemaker and threaded up, and then it makes your tongue protrude at night, keeping it out of the airway. Many decide not to have it. It is effective. It is FAA approved. But we talk to patients what they're willing to do because sleep apnea does need to be treated. Anything that's moderate or severe, meaning more than 15 breathing pauses a minute. I mean, I've had people with 120 breathing pauses a minute, which is, or 120 an hour, which is twice a minute. That's a lot of breathing pauses to be treated. And we know untreated moderate or severe sleep apnea leads to heart disease, high blood pressure, stroke, cardiac failure, things that you want to prevent. We don't know how much the mild disease, I mean, between 15 and 5 events per hour, because a lot of people don't get to clinic when it's mild, and we don't know what happens to them. We do treat them if they have excessive daytime sleepiness, they have heart disease, high blood pressure, etc. So you have a problem. There are a number of sleep disorder centers in Atlanta, lots of them. Not all of them are accredited, meaning accredited have to provide more than just sleep apnea tests. They can treat the gamut of sleep disorders, meaning insomnia, apnea, narcolepsy. There are many that are not accredited, and you can look up to see if they're accredited. You want to come through Atlanta or Emory, all you have to do is call Executive Park Drive and schedule an appointment. You don't have to have a referral unless your insurance requires it. If you live in the suburbs, there is a link that I've embedded that will allow you to find where the accredited sleep disorder centers are in your suburban area. And I really do encourage you to go to an accredited center. One of my friends whose sister is a radiologist and retired lives in Western Colorado. So this is on the other side of the mountains from uh, Denver. Went to a sleep center, was diagnosed with sleep apnea. It was a local center. They literally dropped the CPAP machine off. She had questions about how to use it. They said, oh, never mind, that's not important. Of course, if she had problems with her mask, there was no follow-up. He ended up asking me to talk to her, did some problem solving, explained about it. Many of these just will send you a sleep test and will prescribe the C. Yeah, your insurance is going to cover it, but you may not get follow-up. And if other than sleep apnea or sleep apnea and insomnia, they're not going to be able to treat you. Now, I will say some of the accredited centers do have wait lists. And we have now, when I started in 2010 here, seeing patients half day a week in the clinic, we had 4 providers. We now have, I wasn't able to cram pictures in. And unfortunately, we have a wait list, usually of 2 to 3 months. If you can have a flexible schedule, we'll suggest you get put on the wait list and you can come in when we have a vacancy. We used to do all in-lab studies for sleep apnea. We didn't have the technology we do today. Many of our studies, insurance do it at home first, which if you have sleep apnea, it's designed to detect that. You have some other disorder, it won't detect periodic leg movements, and we'll have to bring you in for a nighttime study. Again, that's also treatable. But as you can see, we have a variety of specialists, psychologists, pulmonologists, lung specialists, neurologists, uh, registered nurses that are nurse practitioners. I'm boarded in sleep disorders medicine like a physician because I took my boards in the 80s when we still could. Um, but all of us are comfortable with a wide variety of cares. And CHOA has a sleep disorders clinic for kids because they do develop apnea. Kids with, say, pulmonary hyperplasia, chronic illnesses may have big problems than a healthy child. And they've developed a pediatric specialty that works very effectively with children. So, questions. And I'll come out of the share and we'll see which ones are in the chat. And depending on you to read the chat. Well, let me see if I can see.
Let's see. We do have one in the Q&A portion. It says, I once had a dream where I was physically bruised, and upon waking up, the bruise was physically present. How would you explain that?
You probably bumped yourself or hit yourself with something, acting out your dream a little bit. One episode isn't so common. You may have also been sleepwalking, which doesn't occur during dreaming, although it doesn't sound like you were out of the bed. And adults don't normally sleepwalk, but some people do. You see it more in kids.
Mhm.
Usually the bed partner is the one telling you you acted out your dreams more than waking up bruised, but you did something to yourself.
Mhm. We have another
And
question.
4-year-olds have sleep apneas? Yes, 4-year-olds can. What we see in young children is compared to their airway, their tonsils are large and may obstruct or, they get an infection. But yes, kids can have sleep apnea if their normal weight sometimes just removing the tonsils opens up the airway. We sometimes see kids that behave like they have ADHD, hyperactivity type. They're running around, they're tired during the day, and they have breathing problems at night. And unfortunately, we have more kids that are obese or overweight. And if they have sleep apnea, removing their tonsils isn't going to cure the problem. They need to use a mask. And we've worked with children to use a CPAP mask. We've worked with Down syndrome children to use a mask. The ones that have autism are going to be very difficult if they have apnea, but they have their own sleep problems. But yes, kids do have sleep apnea. And they should be evaluated if they have more than one breathing pause an hour, their airway is collapsing for some reason. Uh, Okay. If you're over 58 and have trouble staying asleep, we may need to look at your health. We may need to look at things that are going on. That's a little early to have all these fragmented awakenings. We may look at your medications, and if you know it, if you're postmenopausal female, it's that's usually what presents, along with frequent urination or fatigue. But that waking up frequently mean that you're waking up to breathe at night, which is you're annoyed because you're waking up, but it's protected. And if you don't have a bed partner to tell you about snoring or breathing pauses, sometimes you say, well, when you go visit somebody, what do they say? There are also some apps you can put on your phone, like Snore app, and you can go online and look, that will record you at night to see if you're snoring. You got to be wary. I was playing with one of them and I could hear my dog snoring through the bathroom door and it picked it up. So if you've got dog or partner snoring, that may also be recorded. 58 is a little early to be waking up a lot at night. Okay. Kick your feet, moving back and forth. That may relate to the periodic leg movements, and that can fragment your sleep. And you're waking but such short periods, and you don't have any memory. That is also treatable. Very often, it's the bed partner that notices this. And some of our patients that have the periodic limb movements at night also have restless legs just before they go to bed. They feel like they need to keep moving. Their legs and feet feel funny, tingly. If they sit for long periods, like at church or a concert, their legs bother them. But periodic limb movements, the feet kicking a lot, feel like you're running, may be disrupting your nighttime sleep. And again, that's treatable. See. Another dream. Wow. Don't know what your dog was doing. Certainly it was vivid, and I'm not a specialist with dreaming, but people do often feel like they're being attacked, particularly in the REM behavior disorder, but people can have frightening dreams that are not acting them out. And I don't know if you were dreaming that your dog was pacing in that direction or growling, or if that was something you noticed after you woke up. Do 4-year-olds go out of sleep apnea? If it's not the tonsils and adenoids, maybe not. Certainly nasal congestion and allergies make all the tissues swell, but the apnea is usually caused by something further back. And we recommend, if they have a lot of allergies, that people do use Flonase. But if they're snoring, if they're waking up a lot, if they're tired during the day, pediatric sleep specialists should stem. Um, I, you know, that they're giving you a hard time when you got a concern. Is waking up tired regularly a sleep issue or a mattress issue? If it isn't your mattress, it probably is your sleep issue. Adults should wake up refreshed, reasonably energetic. Now, I'll admit it takes me a little while to get going, but that's been true all my life. But once I get, but waking up tired, if you're not get first, is your mattress causing you pain? Uh, are you getting enough sleep? And then if you're still waking up tired, it needs to come into the sleep clinic. And we often find many of our apnea patients wake up really tired in the morning. Some of them even have a slight headache that disappears without medication in a couple hours. They wake up with a dry mouth because they've been breathing through their mouth trying to get air in. But if you're regularly waking up tired, getting enough sleep, it's probably more a sleep problem than your mattress. Um, could this be sleepy paralysis? I'm not sure what you're referring to, but some people do feel momentarily paralyzed just as they fall asleep or just as they wake up. This is usually associated with sleep deprivation. We see studies have shown that medical residents, as they start with their clinical hours, that may never have had sleep paralysis will suddenly begin to experience it because they're quite sleep deprived. We also see sleep paralysis in narcolepsy, which is a disorder of excessive daytime sleepiness. Um, but sometimes people are simply sleep deprived and they can't move for a few minutes as they fall asleep or wake up. And let's say it's quite scary. Is there a way to access the recording? I believe you can answer that, Grace. Okay, warm milk and honey help you fall asleep. If it feels good, do it. There's no evidence that will help you. There is no evidence that lavender, etc., will help you fall asleep. It's not harmful. There is a little evidence about chamomile tea, not strong evidence. Melatonin, yes, it's natural. We have it, but people are using large doses. They only need a little bit. And if somebody's going to take melatonin, we really need it to be taken 2 to 3 hours before they fall asleep. It's not like a sleeping pill that's going to act in 20 minutes. If you're having trouble falling asleep, what we really do recommend is not going to bed until you're sleepy because we get in the habit of staying awake in bed. And we don't like to think we're Pavlov's dogs, but we begin to respond to our bed as a stimulus for staying awake. And some people that have trouble falling asleep at home, when they go to a hotel, they'll actually fall asleep better because they're not conditioned to it. Unfortunately, most of the natural aids won't help. They're harmless. If they feel good to you, no problem. I think that's the end of the chat questions. We have a couple more minutes. If you have more, type them in. Oops. I think I got everybody.